Aeris Family Dental continues to offer innovative techniques to its patients.
It is 3D scanning. That's what we're talking about today. And here to show us what it can do for you is Dr. Lan Allen with Aeris Family Dental. Great to have you here.
Thank you
We've
for having
been
me.
watching you kind of play around with this, and I'm really curious because there's music that's involved. So let's tell us about this new technology.
So this is a 3D scanner. Traditionally, we would take impressions of teeth. We did mix up goop, put it in the mouth, let it take a couple minutes to set. Always tastes very good, right? So we've moved on, we've evolved. Now we can take a scan, which is actually live video, and it pieces together all of those images to create a 3D rendered model.
Well, and just using the word goop, I mean, it's not as precise as
Very
something
technical.
like this can be, right?
Yes, this is actually very precise. You get one of the problems with the old technology is of technology, I'll call it, the old methods of taking impressions is that you would have a material that expands and then the next one you put in contracts, and so it all changes. Whereas this, we get down to about, I think the measurement is about 40 microns, which is a fraction of a millimeter.
Accurate. The first thing I thought of was 3D printing. Is that kind of what this is like?
So this could be used to create 3D printed things. So in dentistry, 3D printing is more for kind of the model work. We're not quite, the FDA hasn't really cleared long-term things to be in the mouth for 3D printed stuff. So if people come in and tell you they have something 3D printed in their mouth, it's either temporary or they were kind of mistaken.
Well, and it's just one of those amazing tools in your arsenal to help people have their best smile, look their best. So show it to us a little bit. You brought the actual unit to demo here. Yeah,
like I said, we normally have it all kind of tidied up a little bit. So we're sorry for the cords and everything.
No, it's okay.
We'll get, so the unit actually consists of this wand. This is what goes in the mouth, just right here. It might look big, but most of the technology is outside of the mouth, and then this is just inside the mouth. It uses a mirror there to kind of pick up the images, and so I'll show you what I'd scanned earlier here. If I can get, the mouse doesn't like the white table.
It's okay. Technology.
Yeah.
Can't live with it.
So this is an example. Here of this model that's on the computer that I just scanned earlier. I'll just show you real quick how it captures.
Amazing technology.
Well, and people hear about this and they immediately, I think, are calmed because people are worried about going to the dentist, and anything that gets close to their teeth, it's like, oh my gosh, nerve pain,
it's
right?
True.
And so
Absolutely.
When you're saying some of this is done mostly outside of the mouth?
It is, yeah. The other thing with taking impressions is that gagging is a frequent problem, and that's
my
mostly
issue.
eliminated.
Right, what people are thinking of.
So I wanted to show you here. This is just kind of picturing, if you can kind of go more to the laptop screen there.
Yeah, let's get a video of what's going on there.
So it's just taking live video here, and it'll just fill in all the holes.
It's just amazing.
The music is a nice
The music
touch.
makes it happen too.
So the music is to let us know that it's actually picturing or gathering. If I go off, it'll quit playing the music. So one of the advances is we can change the music. So I'm thinking maybe a little Pat Benatar, Hit Me With Your Best Shot.
Oh, that's the first thing I thought of.
Get a little rocked. I kind of like this. It's relaxing music.
Right.
And so talk about the uses for this specifically, because it's used for a lot of things, right? Implants, etc.
It is. So the technology is always evolving. What we can do is that we can put little pieces inside implants that stick out of the implant, and then we can take a scan of this, and it tells us exactly how the implant is positioned, turned, the height. All of that is very accurate at this point.
Right, well, because people with dentures complain a lot that they're not quite perfect, and that can drive you absolutely crazy, I would imagine. Just like having a strawberry seed in between your teeth. I mean, if you're having to deal with that every single day just because something is off, I mean, this would be the perfect
it's true.
solution.
So one of the things that would help, like denture wearers, for example, is if they have a denture that they're very, very comfortable with, we can take an exact replica.
That's great.
Of their denture.
People might be wondering, is this going to cost me extra to get this done?
No, that's the great thing about technology is as we go and it improves things, it further increases our, how well and how fast we do stuff. So we're actually getting back the dental work faster from the labs, and so all of that just adds up to more savings.
It's more efficient. Not only that, but people aren't going to be surprised by how much their procedures cost, because you guys have an amazing price estimator on your website, which we're going to get them over to. But doctor, as always, thanks for being here.
Thanks, doctor.
Thank you.
Nice to see you.
Appreciate it.
If you guys would like to learn more or book an appointment at one of their 3 locations, head over to TucsonTeeth.com, and there you can see that price estimator we were talking about.